Artificial intelligence, or AI, it's in the news a lot these days. And one of the brighter points of it is the effects it has on the field of medicine. University of Michigan Health West is using the latest tech to get even better results for their patients. And here to explain how that's happening, Dr. Mark Trail, who's using AI in the fight against cancer. Good morning, doctor.
Todd, thanks for having me. Very happy to be here.
I'm excited to talk about this because, I mean, AI is a hot topic. It gets talked about
all the time.
A lot here in the newsroom. Is AI, the concern is that sometimes people think robots are going to be doing the surgery. This is going to replace my surgeon. This is more complementary, right?
It's a co-pilot. It's not an autopilot.
Good.
So we don't ever use it autonomously. There's times when it needs less help. But we're always there to supply that.
Absolutely.
So it's my assistant.
I love that. You've got an assistant, and then you've got a certain algorithm now that you want to talk about that specifically speaks to breast cancer.
Correct.
Profound, is that what it's called?
Correct. It's Profound Risk. It's from iCAD Medical. It's been out for a few years now. We were actually one of the first sites in the country to have it for the detection algorithm, and they also have a risk algorithm now, which is very exciting, which can actually predict the risk the patient has for getting cancer in a short interval, actually down to 12 months.
Wow. So you're using artificial intelligence algorithms to determine whether a patient may be more susceptible to getting breast cancer.
Right, correct. And we also use it for diagnosis, identifying cancer on a mammogram. You got to understand, when you look at a mammogram, there's hundreds of images literally in it. It depends on the human recognizing the cancer. And sometimes you just don't recognize things. It's a very reflex mental process. 10 to 30% of cancers are missed on the screening mammogram. So not recognizing cancer happens a lot more than people might realize. Now, a lot of the time the cancers are slow growing, so it might not have that big of an impact. But it's totally in the AI wheelhouse to be able to look at a mammogram and literally draw a circle around the cancer and tell me, hey, look here, I think this is a cancer. And I have had multiple small cancers that have been shown to me by the algorithm that hopefully I would have seen, maybe not. So it's an insurance policy that I'm doing the best job I can. For me, I have a ton of, stress. This is difficult, risky business. At the end of the day now, I'm much more relaxed that I didn't miss anything because I have a second reader, the algorithm, looking over the images with me and telling me if there's anything there. And actually, the performance of these algorithms, we can actually find cancer. The sensitivity is higher than a human. So it's
So it does the job even better.
Correct. I mean, you need to sort out what's not cancer, which it doesn't necessarily do as well as a human. So, but for the bulk of the cancers that come across my screen, there's going to be a circle around that cancer to make sure I don't miss it.
Because of this algorithm?
Because of the algorithm. It's able to identify characteristics that are malignant on the picture and tell me, this is where the cancer is. The image-based risk backs the clock up. It can actually detect changes in the mammogram that develop before the cancer is visible to the human.
And that's before it's even visible to a human.
Correct.
I mean, and we hear so much about early detection.
Correct.
Have you found that this is the earliest detection yet?
Well, you can't really call it a detection, but because there's not really something to point at yet.
Sure.
But the algorithm, it gives you a number for the risk. This is all math. And it's very consistent, it's very reproducible, it's very reliable. And so if you get a high number from the risk algorithm, which looks at the image, the chances that in the next 12 months that patient develops a cancer are much higher.
And this gives you the opportunity to alert that patient for that early detection. Because we hear early detection.
It's all about early detection, especially in younger patients who tend to get the more aggressive cancers. These are also the young working moms who really don't have time, any day. So if we see a high score, it's an alert to that patient. Hey, look, don't skip your next mammogram. Consider doing additional ultrasound. Maybe we want to do an MRI. So most breast cancers don't have a family history. Everybody's familiar with how that works, and genetics is a big part of this, but that's only 15% of the cancers. So the vast majority, 85%, don't have a genetic background to tip the patient off that they're at high risk. We can look at a mammogram and tell that patient that there are changes developing here that we have seen in patients that go on to develop cancer in the short term, so they can take the actions that they need to get the detection early.
And that really is a key to
It's everything.
Saving lives.
Yeah, it's everything. And the message too I want women to realize is this is out there. It's been researched. It's solid. Every paper that comes out shows that this works. Its adoption is kind of moving a bit slower than I would like to see, in part because women don't know about it. It's new, and you know, insurance companies don't reimburse it at this point.
Well, we've got short on time. We want to make sure we get this information out. But the key, what you're saying is women, you need to know
I want
this.
women, yeah. My main message today is that this is out there. It's wide. We've been doing it for 4 years. This is nothing new for us. It's available. It can really make a difference, and you should ask for it, advocate for it, and use it.
Yeah, absolutely. And you can get more information about it at uofmhealthwest.org. Thank you so much for that.
Thank you.
Absolutely.
Appreciate it.